Okay, today is Friday, July 18th, and I'd like to bring forward what I've received so far from JACHO, because like I said, I've turned the hospitals that denied me emergency services into JACHO so far, licensing and certification, and the Office of Inspector General. Let me go ahead and show you what I've received, and please notice in the CC that I've sent it to, Health and Human Services, and of course the California Department of Public Health, and naturally Social Security and CMS. I basically have covered all bases. Now, what you have to understand about JACHO is you have to understand some modern concepts. One of the modern concepts nowadays that shall we say corporations rely upon is planned obsolescence. Well, if I build a car, it's going to last 5 years, 10 years. We plan for it to go away. Okay, the other thing that you have to learn, about corporations, non-profits, regulatory agencies, any of these things, is the principle of evident intent. Now, this is a strange and odd principle, but yet it holds true. The principle of evident intent basically means that, when an organization becomes so large and everything else, it basically begins to feed on its own mission and scope statement. Anything, to stay open, to survive, as opposed to, let's say, delivering, the services promised in the mission and scope statement of its, organizational paperwork, whatever the case may be. You have to think about it in these terms. Now, if they corrected the problem, would they not be, basically doing themselves out of a job? Now, since I'm explaining this to you, the reason I'm bringing this up when it comes to JACHO is because the principle of JACHO is there for, I believe it's the Joint on Accreditation or something for hospitals. Anyway, so some things I want to bring forward. I'll go ahead and start. I received this email from JACHO in regard to San Francisco General Hospital, July 7th. Dear Mr. Garza, thank you for sharing your concerns with the Joint Commission. The Joint Commission takes seriously any information about one of our accredited organizations. We review your concerns to determine if we can take action. Our options include: continue to evaluate this organization. Second option, ask the organization to provide the Joint Commission with a written response regarding your concerns. Third, evaluate your concerns during an on-site review at this organization. Next paragraph, the Joint Commission does not access specific care of individual patients. Are you beginning to feel something not correct, not proper here? Thus, we are unable to tell you if appropriate medical care has been provided. Excuse me? What? What is your purpose? If I'm turning them into you, to say that they've done something wrong, and you don't find that they've done something wrong, what does that mean? Do you settle with them? No finding of fault and guilt, but yet, pay us this little fine? Sounds like self-promulgation to me, but what is it doing for the victim? All right, let's go on. For example, if we get a complaint regarding a patient's infection, we will look at an organization's infection control practices and policies to determine their compliance with the Joint Commission requirements. If any opportunities for improvement are identified, we will work with the organization to correct practices and systems so that they may meet or exceed our standards. It's interesting because would not a standard be to find, fault and guilt? Depends on what the standards are there for. You should understand that our purpose is to help improve the quality and safety of care. Well, for me, that's quite an oxymoron, because if there is no finding of guilt and you can't help the patient, who are you helping? How does this improve the quality and safety of care? Actually, I think it's quite the opposite. I think it diminishes it highly. You may receive a letter with more information. In addition, with our public information policy, this letter will not include any specific results of our evaluation. So let me see if I've got this right. I've turned them in You know, you're not going to tell me whether they're, you know, they've broken the law. Oh, and in addition, you know, you're not going to include any specific results of the evaluation. So, what was the purpose? And for whom? My. So, in the end, if anybody collects a fine, it will be whom? Let's see. What about self-promulgation and the principle of evident intent? Wow, it's really working here, folks, because mind you, if they don't fix the problem, because we don't get a finding of fault and guilt so that we can set precedents and continue to hold these people accountable so that the second time it happens, you know, it'll be even worse and it just will never happen again. Oh, no. We can continue with the charade in healthcare, you know, continue to, of course, help the patient. Mind you, help the patient. Should I say it for a third time? Help the patient. Of course, their help is providing nothing, but that's what they classify as help. Examples of the information provided are a listing of the standard areas that apply to your specific complaint. Oh yeah, the policies, big deal. The listing of complaints filed against the organization that are related to Joint Commission standards. So, who cares? We've closed the case. There's been, you know, hundreds of complaints, but, you know, we don't have to find fault and guilt, you know, la 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 la. Thank you for bringing your concerns to our attention, and while the evaluations or actions we may take cannot affect the care of one received in the past, the information you provided is used to improve quality of care delivered to our accredited organizations. Well, let's continue to put it up on the, you know, chalkboard and, you know, analyze it. Please include the incident number at the top of this letter for any future correspondence regarding this matter. Well, you know, I just simply hit the click response button and responded, and I'll read that to you. Now, the reason I'm bringing this up is that you have to understand that in 2001, I was illegally denied emergency services at San Francisco General and turned San Francisco General into JACHO, licensing and certification, CMS, and, you know, they all told me I was wrong. Shall I say that again? They all told me I was wrong. After I went back with the signed confession, asked me if I received any follow-up from JACHO, CMS, or licensing and certification. Are we learning the games? So let me see if I've got this right. In 2001, you know, I did the correct thing, turned them all into the regulatory agencies that are supposed to be there, which basically did not perform, that got it incorrect, and when the Office of Inspector General, you know, got the signed confession, you know, and I took that back, they couldn't account. You know, it's marvelous. Now, mind you, this was JACHO, licensing and certification, and CMS. So, you know, the important thing is to remember all the people that I've addressed in the addressee line. You know, once again, you know, the OIG, CMS, the California Department of Public Health. You know, you have to ask yourself where I have all these email addresses. It's because I've had them in the past, and, you know, this has happened before. Anyway, so I wrote back, you know, and said, you know, basically I hit the reply button. To whom it may concern, I still await response to the prior email I sent in over this case. Please respond as soon as possible. P.S. I am also awaiting the St. Mary's and UCSF follow-up also. So originally they had sent me something and I had responded back on 6/20, and here's what it says. To whom it may concern, please explain. The Joint Commission does not access specific care of an individual patient, thus we are unable to tell you if appropriate medical care has been provided. Instead, our evaluation focuses on the process and policies that are required within our standard. For example, if we get a complaint regarding a patient infection, we will look at the organization's infection control practices and policies to determine if their compliance with the Joint Commission, requirements. If the practices and systems so that they are, if any opportunities for improvement are identified, we will work with the organization to correct practices and systems so that they may meet or exceed our standards. You should understand that our purpose is to help improve the quality and safety of care. Well, I've already read this to you. I've already told you why it doesn't hold water, but let's continue. Please be aware that in line with our public information policy, What an oxymoron. Public information policy. We cannot provide you with specific results of the organization's response. Well, let's see if I got this right. I'm the public, I'm the person who brought it to them, I'm the person who's complaining, I'm the person who's had the law broken against me. They're supposed to be there to regulate it and make sure that the laws have been complied with. They can't, find fault and guilt. And what was this again? Now they have a public information policy? You mean a public misinformation, disinformation policy? Well, I'm much more inclined to believe that. Thank you for bringing your concerns to our attention. Please include the incident number, blah, 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 blah. Okay, so I write them back and say, in 2001, I brought San Francisco General to JACHO and they failed. Here is the confession from the Office of Inspector General. Therefore, I want to be sure that you do provide, since the last failure was never explained. Please contact me as soon as possible. Then I move on and I say, why would anyone bring forward an issue to you if you cannot have a finding of fault and guilt? I also do not understand the part of your policies if the failure occurs and what type of quality and safety of patient care. If there was no care and no quality. Well, it's what did the patient get? What did the victim get? How is JACHO not doing the right thing, quality patient and safety care? Mind you, I still await an answer for your last failure. Please contact me as soon as possible and I will follow up. P.S. I also sent in the same day other complaints in regard to the denial of emergency services at St. Mary's and UCSF. When will I hear about them? So, these were the things that I wanted to bring up. Now, remember, I told you when I went to back to them and showed them the confession, there was no follow-up, there was no reopening of my case, it was basically, I guess, a pass. Isn't it wonderful? Isn't it marvelous? Had they done their job and found fault and guilt, notified me of such, maybe it wouldn't be happening again. But wait a minute, wouldn't that put them out of a job? Sort of like all the non-profits that are claiming to be here for health care in San Francisco. So like I said before, why would anyone use this service other than to line their pockets? If JACHO is wrong, like they've been in the past, so what? If the victim is correct, like I have been in the past, and I'm correct now, so what? They're not going to be there to help me and find, fault and guilt or anything that I can use. How is that patient care, patient safety, patient quality? The oxymoron just continues. But, I'm glad I'm able to bring this forward. And please realize that I'll be working, on another video in regard to CMS, and their failures, the Office of Inspector General, and how that's set to fail and why. And licensing and certification. So I just want to bring this forward for anybody who has been maltreated by not only the hospitals and the medical community, but for you to understand what you're up against when you go to the agencies that are there to, I guess, protect them and get their reward for having done so, because they're the ones that collect the fine, not the victims. Live, learn, watch the games and learn the inhumanity, and continue to watch, because like I said, as I get more paperwork, I will continue to do the right thing, follow up, ask the right questions, show you the fact that I get no responses, and continue to show you all the inhumanity that I have to deal with. Being, shall we say, once again, dead, for the third time, dead right.